Welcome to the Erie Wellness Podcast, your go-to source for all things health, wellness, and living your best life right here in Erie. I'm your host, Lauren Brunetti, and I'm so excited to have you here. Each episode, we'll dive into conversations with local experts and wellness professionals who are making an impact in the world of health and well-being. Before we jump in, be sure to like, share, and comment on this episode. We love hearing from you and seeing our community grow. Now let's get started. Hello, friends. Welcome back to the Erie Wellness Podcast. Today's episode is such a good one. I'm sitting down with Shelly Beckley. Shelly is a board-certified nurse practitioner and a Menopause Society Certified Practitioner with over 20 years of experience in healthcare, including 14 years as a nurse practitioner. Over the years, she's seen firsthand how traditional medical care, especially when it comes to women's health, can feel impersonal and even outdated. What I love about Shelly's work is that she's on a mission to change all of that. She brings a fresh, personalized, and truly innovative approach to care, and I can't wait for you to hear what she has to share with us today. Shelly, welcome to the show. I am so glad to have you here.
Thank you. I'm excited to be here.
So you started your career in oncology, which is such a meaningful and intense field. Can you share a bit about what led you from there to opening Brio Health and Wellness and how your own health journey shaped the work you're doing now?
Absolutely. So, I think in oncology, what drew me most to that field was just the opportunity to be with patients during this time in their life where it truly was, the worst time. And it was just an honor walking with them and their families through this time and seeing a change. It's been interesting over the years seeing the excitement in research studies and this change in medicines that have been done. And as part of the treatment in oncology, we have suppressed hormones for different treatments. So just working in kind of that realm in prostate cancer and in breast cancer, seeing how hormone treatments really affect patients, how suppressing hormone levels have side effects of these. And, specifically in breast cancer, it was really interesting watching over time. First, we weren't able to offer patients anything who were miserable because they had no hormones. And then it was safe to prescribe vaginal estrogen. And then all these little changes that had happened. And then I went through perimenopause and truly felt like I was going insane. And struggling to find a provider that would listen to me because I went through it in my early 40s. And finally, when I found somebody and I started hormone treatment, it just changed me. And I was like, everybody needs to know about this. Women should not be suffering. And it really just changed kind of my whole outlook on what I want to be doing, what I need to be doing. So that's why I opened Brio Health and Wellness.
I love that you have a professional connection and watching women be transformed kind of throughout their treatments once they started using hormone therapy, but then also your personal experience. And I feel like once you have that personal story, it really kind of ignites all your passion and your desire to help other people with that as well.
It definitely does. Absolutely.
For those who might not be familiar, can you describe what metabolic health really means and why it's important for women in midlife to pay attention to it?
Absolutely. So on a basic level, metabolic health is just how our bodies are taking in the calories, taking in the food we eat and processing them, and how, we change those calories to energy and what our body does with it. And it is, controlled with blood glucose. So how our bodies tolerate glucose levels, and it can be cholesterol related, high blood pressure. All of these symptoms and systems within our body are all related back to metabolic health. And I think that particularly in midlife, we are having changes with our hormones. So estrogen levels decline, progesterone levels decline, and we are seeing changes metabolically just with the hormone levels. And then when added to it, all of a sudden we're having high cholesterol that can be seen. We're having high blood pressure. Our glucose intolerance now is completely messed up. I think that it's particularly important that women in midlife pay attention to metabolic health along with everything else.
Mm-hmm. Because from our metabolic health, it's kind of how our cells are all being fueled, right?
Yep.
And when our chemical messengers aren't working properly and those cells aren't working, then all of the instructions on what they need to be doing is all messed up.
Exactly. And it can lead to all kinds of different disease processes. Like I said, obesity is one of them, high blood pressure, high cholesterol, type 2 diabetes, all kind of relates back to metabolic health.
What would you say are some of the things you find yourself saying over and over in patient consults and those common concerns or misconceptions that seem to come up all the time?
That's a great question. I think that probably the top two are, I am doing everything that I used to be doing, and it's no longer working for me. Um,
Mhm.
and there it's, during perimenopause and menopause, because we're seeing these changes in our hormones, we are also seeing metabolic changes. And so the way that our body processes things is just different. And what we used to be able to do is no longer going to work for us. Exercise routines, dietary, needs, and how we respond to that, it's just not going to work the same. And
Mhm.
our metabolism changes. We see a reduction in metabolism due to muscle loss. We lose our muscle mass over time. And so we see changes there. There's just so many different processes that truly we need to get down to the root of the cause and what is going on and then make changes from there. I think the other thing that I hear all the time is, I'm just getting older, so I'm just going to have to deal with it. And, that is so not true. Yes, it's inevitable that we age, and aging is a blessing, but we don't have to be miserable, and we don't have to just sit by and have all of these changes occur without doing something. There's absolutely preventative things that we can do and that we should be doing to keep our best health going forward.
What would you say are like the key influencers on our metabolic health? Because it's not just necessarily what we eat or the way that we move.
Absolutely. I think, especially during this midlife time for women, hormone changes. And so, doing some hormone replacements, if it's right for you, is certainly going to make a change and a difference for our metabolic health. I
Mhm.
think that really figuring out what is going on. So, the treatments that I like to do are basal metabolic rates. It's, body composition, seeing where our fat composition is, where our muscle composition is, all of that, and then making a plan going forward. So like you said, it's not just what we eat, it's what we do and how we do it, and it's not just calories, and it's not just a number on the scale.
Mhm.
There's just so much more to it than that.
How do your caloric requirements change for women during perimenopause and menopause?
So a lot of times the caloric need will go down a little bit. And again, that's because we are losing some muscle mass, and the muscle burns a lot of calories. And so when that declines, we can see that our caloric needs go down. Also, a lot of women are very fatigued because of hormone changes. They're not
Mhm.
sleeping well, they're having night sweats. All of these different things can start happening. And so when we are so fatigued, we are maybe not moving as much. We're not exercising. We are not, getting the steps in that we need. And so because of that, also our caloric needs go down a little bit. I think it's very important to note caloric needs and restriction, and all of that kind of goes hand in hand too, because a lot of times during midlife, our weight starts to creep up because our metabolism slows. Our caloric needs do go down a little bit. We're not adjusting to that. And so we can see weight loss.
Mhm.
And that's when women are typically saying, I am doing the same thing I always have been, and now it's not working. And so we need to make sure that calories aren't being restricted too much, because when you restrict your calories too much, your body can go into a starvation mode and really hang on to every single, calorie that we are taking in, and we can't burn it off because it's just a starvation mode is seen. And so making sure that you are eating enough calories, you're eating the right type of calories, all of that is very important.
When talking about caloric needs, can you kind of break it up? Like, what are the different um, areas of nutrition that you really try and hone in with your patients? Like, healthy fats, carbohydrates, fiber, all of those things.
Yeah, so exactly what you said. They're all important. Protein is huge. So making sure that our protein intake is where it is, especially during this time that it is difficult for us to maintain muscle mass. Protein is going to be very important. Fiber, insoluble fiber is going to be very important. During midlife for women, our digestion system slows. And so we can get constipation much
Mhm.
easier than what we used to. And so fiber intake is very important. Vegetables, fruit, that is all going to be very important to make sure that we are getting in enough of what we need. The refined, processed, white flour, all of that is going to be important to limit too, because our body changes that into glucose. And, our tolerance for glucose kind of goes down and how it's processed. And so it's very important to really look at exactly what we're putting in our mouths. And I don't believe
Mhm.
in diets. I think that diet is not something that we should be doing. That's something that we can stop very easily, and then you can see a lot of weight changes. But I think making a real health adjustment is what needs to be done.
And making sure it's sustainable too. If you don't think that you can be on this same diet a year from now,
Yes.
it's the wrong diet or the wrong way of eating.
Exactly. And, it is so hard because a lot of us have families and we're busy and it's crazy. And so sustainability is something that is a struggle, but it's really important to find what works for you, and what works for one family is not going to be something that works necessarily well for the next family.
Mhm. You mentioned, like, insulin resistance. Can you explain a little bit about that and how that impacts your metabolic health?
Absolutely. So our body tolerates insulin and processes insulin differently when we're younger than as we get older. And
Mhm.
part of it is hormone changes. And, as we go through this midlife change with our estrogen levels declining, we're not able to um, tolerate glucose levels, and our blood sugar goes up and our A1C goes up. And all of this just really starts to change for us. And it's a struggle. And inflammatory markers go up. And that's truly what we see when we see a lot of this glucose intolerance is inflammatory markers that are off the charts that can cause a lot of visceral fat changes. So all of a sudden we're starting to gain fat in our middle, which is the biggest risk factor because the fat gets around all of our organs, that
Mhm.
are in our abdomen. And that's really what we need to look at, and it's directly related to insulin tolerance.
And insulin is a hormone, correct?
It is, yes.
Okay.
Mhm.
And what would be some of your suggestions to kinda keep your body in, like, fat burning mode versus, storing it?
So again, making sure that you know exactly how many calories that you need at a base level is
Mhm.
important. And then, from there, we can kind of make adjustments to, do you want to maintain your weight? Do you want to decrease your weight? What you want to do? And it's truly a personalized plan to make sure that you're in this fat burning state. Again, what is on one person's table that works is not going to necessarily be on it for somebody else. And so, making sure that, kind of generally speaking, we are moving our bodies.
Mhm.
When we get older, we need to make sure that we are lifting weights. That's going to help us to burn this fat, especially because, you're having muscle loss, you're having bone loss, all of these changes. And so lifting heavier weights is going to be able to reduce that. It's going to be able to make sure that you're burning calories like what you used to be. Um, Cardio, it is still beneficial, maybe not as much as before, because really we need to pay more attention to our muscle mass.
Mm-hmm.
But, cardiac output is still an important factor. And just making sure that we move and we're finding enjoyment in our movement.
That's all such good information. So how do you approach calculating or like estimating caloric needs for your patients?
So, an important thing for me again is stop looking at just the scale numbers. And I think that's a whole mindset shift that we need to do.
Mm-hmm.
There's a couple different ways that I like to go about this. So I had talked just briefly about body composition and metabolic testing. So both of those are part of my practice. And I have a couple different machines that I do this with. But the body composition really shows us it breaks us down into, your trunk, right leg, right arm, left arm, and looks at muscle composition, fat composition. It can tell us our water distribution, if we're hydrated, what that looks like. And then
Mm-hmm.
the metabolic testing tells us exactly how many calories we need to take in at a baseline. So if you did not do anything, what we need to take in to live to keep us healthy. And from there, then we can start talking about a patient's goals. Again, do you want to maintain? Do you want to lose? What does this look like? And we can start making treatment plans with both food intake and exercise based on their goals.
Mm-hmm.
I think, weight loss in general is a big movement right now, and there's a lot of talk about GLP-1s and that type of thing. And I think it's important to know that weight loss like that, you can also lose a lot of muscle mass.
Mm-hmm.
And so for women who are interested in that, I think it's perfectly fine to talk about. But again, we need to get a baseline of what our body composition is to make
Mm-hmm.
sure that we are not losing a lot of muscle mass because of our hormones during perimenopause and menopause, but also because of some of these other treatments that might help with weight loss.
Mm-hmm. That's so fascinating. I want to try one of those machines. Even the discrepancies of muscle, like versus one part of your body and another. I feel like I'm always a lot stronger on my right hand because I'm
Yeah.
right-handed. So how much less muscle do I have on the left side of my body just because that's not my dominant side?
It's fascinating. And that's one part that I love about it is exactly what you said. I am right dominant. And so I always wondered, when we're doing certain workouts, like I always feel stronger on my right side. Do I
Mm-hmm.
truly have more muscle mass on that side? And it will break it down for you. And then it's like, okay, let's start doing unilateral exercises, maybe with a little bit heavier weights on one side versus the other, or, we can really personalize the plan.
Mm-hmm. I feel like even for GLP-1 patients, it's so
Yes.
important for them to keep track of what their muscle mass is, so that they don't drop below or too
Yeah.
low.
It's very important, especially, muscle burns a lot of calories. And so I think for GLP-1 patients who are losing a lot of weight, they still need to make sure that they are taking in a certain amount of calories. And then when you can see the body composition, it truly is kind of eye-opening and, oh my goodness, I'm losing weight, I'm feeling better, but now I need to work on these other things too. So I
Mhm.
think all of this just goes hand in hand.
Right, I don't wanna end up with osteoporosis,
Exactly.
as I, hit my 60s and 70s and all of those, like, big picture things.
Yes.
Am I not gonna have enough strength to be able to hike when I'm retired? Like, just those, like, long-term thoughts, and making sure you're setting yourself up for success.
Absolutely.
Hey, what strategies do you recommend to preserve or build muscle?
So that's a great question. I think, a lot of women are used to cardio as one of their only forms of exercise. And I think that it becomes really important to make sure that we're lifting weights too, and
Mhm.
not just lifting 3 to 5 pound weights. Women are stronger than what we think. And so, I like the analogy of a woman going to the gym and lifting these really light weights and then going home and lugging in all the groceries and the car seat and a child. And it's like, we are so strong. We
Mm-hmm.
can do this. And so it's very important to, get in the gym and lift those heavier weights, because not only are we going to see an increase in the muscle mass, we're also going to see an increase in our bone strength. So during midlife, it's more apt that our bones will start to get thin. It just happens naturally over time. And so lifting heavy weights will also help prevent against osteopenia and osteoporosis. And the extra muscle mass strength that we have will be able to burn more calories. And so, it kind of goes hand in hand. But I think that really switching mindsets from maybe pure cardio workouts to really introducing some of this weight strength training as well is very important.
Yes, I've been telling myself I need to get more. I mean, I love walking the dog and being outside and like doing yard work and all that kind of stuff, but getting into a strength training routine, for some reason, I just have like the hardest time to get motivated. I know that once I do it, I'll feel so much better, and I see some older mentors and peers who weight train and they look amazing and they're in their 50s and 60s. So they're definitely an inspiration to keep it going. What would you say is some advice to women like myself that just would rather be doing other things but understand the importance of strength training?
I think it's important to find your community.
Mm-hmm.
And there is I have partnered with a gym in Longmont. That's a female only studio, and they are just such an amazing group of women, and they come together and they support each other. And I think that, yeah, whenever you're starting anything like this, that maybe you've never done before, maybe, weight training has never been part of your repertoire for anything. I think that it's a little bit nerve-wracking, and thinking about the normal gym where there's all these big guys lifting heavy weights, it can be very intimidating. So I
Mm-hmm.
think finding your crew, finding your people, finding some place that you are comfortable with is very important. A lot of gyms have classes, like beginner classes on how to lift weights, or they have free training sessions when you join up. I think starting something like that and learning how to properly lift, because that's the other thing. There's a lot of people who don't lift correctly, and it can cause injury. And so I
Mm-hmm.
think just finding your team, finding your support, learning how to do it correctly. And then it's just like any habit. It's going to take a while until it feels like something that's enjoyable to you.
That's such good advice. We hear community is such another, key factor of our health and our well-being. So making sure you have your peers even in that area of, fitness is super important too.
Definitely.
And also, so muscle burns more calories than fat, correct?
Yes.
So would you say that like that muscle mass then would influence your metabolic health?
It does. It helps your metabolic health overall. If we have somebody who has lean muscle mass, who has, strong bones, we see that their metabolic health, and metabolic health is, like I said, it's cholesterol, it's blood pressure, it's, if you are more prone to diabetes, it's obesity. So metabolic health is this word that encompasses so many of our body systems.
Mm-hmm.
When we see somebody who has lean muscle mass, those patients tend to have lower cholesterol, have lower blood pressure. They're not as prone to obesity or diabetes as somebody who just has more fat distribution.
Mm-hmm. Do you also run blood tests for patients?
Yeah, absolutely. Not always. So again, every case is personalized.
Mhm.
In some cases, I think it's very important to see what your insulin glucose tolerance level is. And there's different labs that we can draw to see that. I think that it's important to see, what is your A1C? What is your blood glucose level been over the past 3 months? What's the trend for you? There's lots of different lab work that we can do depending on what a patient wants. Is it always necessary for everyone? Not in my opinion. I think that it's more important to do some of these other tests if they want to see changes. The
Mm-hmm.
lab work will help us, and I think it's nice to be able to see over time how those labs can change. But I don't think that they're necessarily important for everybody.
And there's probably some lab work that comes back normal, but yet you're not
Absolutely.
feeling normal.
Yeah, yeah, and I think that it can be frustrating for patients when they see that, they like, for instance, if you eat a certain lunch, say you have a turkey sandwich and, it's been the same lunch that you've been doing for the past 20 years, and now all of a sudden, for the past 6 months, every time you eat that turkey sandwich, you're exhausted. You feel
Mm-hmm.
like taking a nap. It's just changing. Well, we can do some lab work, and you can do, insulin testing to see, what's happening in your body when you eat that. What's your response? What's going on? And
Mm-hmm.
sometimes it's going to be, well, we can't really see that there's any change, but yet you're having these symptoms of it. So
Mm-hmm.
let's create some change. Instead of that, let's, maybe take away the bread. Let's do this instead. And then
Mm-hmm.
it's more of a clinical, what we call a clinical diagnosis, or how you're responding to things versus actual testing and the answers that those testings show.
Mm-hmm. Can we talk? That brings up a good point, like talking about blood glucose. Because,
Mhm.
so say you really enjoy your turkey sandwich, it's in your routine, you have vegetables and stuff inside of it. But maybe like one thing you can do is go on a walk after you eat that
Yeah,
sandwich, because that would help with your blood glucose and kind of bring any of that bread, maybe that spike that would happen, go down. What are
right.
some other like key lifestyle things that could help with blood glucose regulation?
So, you know,
I mean, even a bad night's sleep too, like that could affect like
absolutely.
how you metabolically um, ingest all of that too.
It does, absolutely. And, hormone therapy. So we're talking about all of these symptoms. You know, perimenopause and menopause is kind of my love and where I'm at right now. And doing hormone therapy, so estrogen, progesterone, that can help with glucose tolerance.
Mhm.
Just getting your hormones to a good place can help you be able to do this. Reduction in our stress. So we know that, glucose tolerance, cortisol, it's all related. The causation is a little bit different, but they're all related. And we know
Mhm.
that, like you said, a bad night's sleep, um, any number of things can cause these levels to go off. When you have high cortisol, you are likely going to have horrible glucose tolerance. And so it's, stress management, it's mind body, it's a lot of these different factors that go into just overall health and metabolic health. And, going for a walk, getting sunshine, even
Mhm.
grounding, getting yourself in nature, putting your feet in grass, all of that has been shown to help in all of this regulation.
Mhm. So, talking a little bit about perimenopause and menopause,
Mhm.
can you discuss the relationship like between insulin sensitivity and those two stages of life?
Yeah, so we know that when our estrogen levels specifically start to decline, we can see changes within our metabolism. We can see decreased glucose tolerance. And, some of that is because we have inflammatory markers that start to increase.
Mhm.
Estrogen is seen as an anti-inflammatory hormone. And so when that goes down, our inflammation in our bodies go up. And that's what can cause some of these, glucose intolerance and different things to start happening. We also think that that's probably why our cholesterol goes up, is because we don't have as much anti-inflammatory hormone levels as what we used to. That's why blood pressure can go up without changing diet or without changing anything.
Mhm.
And glucose tolerance is just one of those things that goes up too as the estrogen levels start to decline. And so
Mhm.
that's why when we do replacement with, whatever form form of estrogen and progesterone, you can see a benefit. You can see that your inflammatory markers start to go down again. You can see that you start to respond to glucose a little bit better again. Our cholesterol levels can go down, our blood pressure can go down. And so, while it's not this gold star treatment, we can absolutely see positive effects that it has in our bodies.
Mm-hmm. In terms of lifestyle interventions, so let's first talk about like diet and like things like instead of eating like a piece of fruit regularly, like adding in like healthy fat to pair it with. That
Mhm.
would keep your blood sugar levels down low.
Yeah.
Do you have any other like dietary suggestions on how to kind of keep those levels down?
I think introducing protein at every meal and with every snack is important, and that can keep things down too.
Mm-hmm.
And, like you said, vegetables are going to be good. Fruits are good, but it depends on the type of fruit too, because some fruits don't have a lot of fiber. So, you want to make sure that you're getting in fiber because that's also going to help your glucose tolerance, is to make sure that there's a large fiber component there too.
What are your favorite like high fiber fruits, but also maybe low on like the sugar spectrum?
So, anything that is like this kind of seed fruit. So plums have that, something with the thick skin, um,
Mm-hmm.
blackberries, cherries, the darker fruits too.
Mm-hmm.
I love bananas, but unfortunately, bananas don't have a lot of the fiber and things, and they're pretty high sugar. Grapes are another thing that are very high sugar. Apples are really good. Apples, the apple skin has a lot of fiber, and they have a lot of stuff that's good for you. And
Mm-hmm.
so, watermelon, not so much. It tastes amazing, but it's pretty much all sugar.
And there's nothing really you could, like, add to it that I feel like they would probably taste funny if you added something that was, like, protein or like, had some
I
healthy
guess you
fats in
can add
there.
sometimes they have, feta watermelon salad, so you can get a little bit of
True,
protein.
yeah, with the feta.
Yeah.
And eating, another thing that I've been taught is to eat, like, your salad first. Like, eat your vegetables first on your plate to kinda keep those down, then go to protein, then go to carbs because we know that the
Yes.
carbs are gonna increase everything.
Yes, exactly.
Okay, so we talked a little bit about diet. Even we know movement is going to help lower your blood sugar. So whether it's movement in, lifting weights or movement in terms of just like going on a short walk around the block, that's going to help.
Yep.
Sleep. Why does sleep like directly impact our insulin resistance?
So, sleep affects so much. If you do not sleep and you are fatigued, everything is gonna be off. All the hormone levels kinda go wacky. Our circadian rhythm, everything gets off when we can't sleep. And
Hmm.
so, as part of that, and it just causes our hormones in general to be off, and as part of that, glucose tolerance is part of the hormone response. And so when you don't sleep, it creates increased cortisol, and again, the causation is a little bit, if you dive into research, it's a little bit uncertain with the causation, but we
Hmm.
know that all of this is related. And so we know that if somebody is not sleeping, their cortisol levels seem to be much higher. And with cortisol levels, decreased glucose tolerance is much higher. And so, it's all hormonally related. And then back to perimenopause, sleep issues are huge. And,
Yeah.
women are waking up in the middle of the night with racing thoughts or with night sweats or with just a number of things. And most of the time, hormone therapy can help with that if you're a good candidate for hormone therapy. And if you're not, there's other things that we can do to make sure that your body is getting that sleep, because that's the time that we also need to give our body the time to heal and repair. And if we're not
Hmm.
giving it that, then that's also going to cause all of these disease processes to come on sooner and just more intense.
Hmm. Okay, so we have sleep, even stress. I mean, couldn't stress then also impact sleep
Oh,
too? So,
absolutely. And again, it's cortisol. When we are in high stress moments, we have high cortisol levels, and we don't sleep well. And I know I keep referring everything back to perimenopause and menopause, but there's so many studies that have been done with cortisol levels during this time.
Mhm.
And it's probably because of lack of sleep and stress. And, over the normal day, in somebody who is younger, we see that cortisol levels at the beginning of the day in the morning should be a little bit lower, and then they kind of go up, and then they have this gradual decline. Well, during perimenopause and menopause, it doesn't decline. It stays elevated right to the end of the night, through the night. And that's when we can see a lot of, being really stressed, having a lot of anxiety, not sleeping. All of these things, again, just kind of go hand in hand.
Mhm. All lots of things to think about, bringing it back to, like, the main pillars of health, and that impacts, the key driving factors on how you're aging, how you're feeling, metabolic health and blood sugar levels. So,
Absolutely.
are there any resources or tools you recommend for women to better understand and manage, like, all of these needs and understandings?
I think that there's a lot of great books that are out there now.
Mhm.
You know, what I recommend is just asking, putting it out there, finding a provider that can help kind of walk you through this. Finding groups, like I said, there's some really good information online, but there's also some not so great information online. And so it's a little bit difficult to um, point directly to certain things, I think. Um,
Mhm.
there definitely are some amazing providers within our area and the surrounding communities that really have an open aspect to hormonal health and nutrition. Um,
Mhm.
and I think just advocating and making sure your questions are being answered. Like I said, I don't love pointing to any one certain online platform because I think that there's a little bit of gray area in all of this.
Mhm. And really just kind of narrowing down, like, where are your strengths at when it comes to those main pillars of health, and where are the things that you're really struggling at?
Yep, exactly. And it's just so personalized. Everybody is just so different.
Mhm. Even just genetics play probably a role into all of it too, so understanding how personalized medicine needs to really be.
Absolutely.
Which is why I love that what you're doing, you're really, instead of just being a number on your chart, like, you're really trying to get to know your patients. Like, obviously, your probably initial content consults were a lot longer than they used to be,
Yes.
and really trying to get down and understand the person.
Yeah. And that's also another reason why I wanted to do something like Brio because in just generalized medicine, being in medicine for so long, I have seen our appointment times decrease again and
Mhm.
again and again. And how well can we really provide care to our patients when we have 10 minutes with them? So I think it's important. Again, there are a ton of amazing providers, but finding the one that fits for you and advocating. And so if you feel like you're not being heard, then finding somebody who will listen to you.
Mhm. As you were talking, I was thinking, how did you even come up with the name Brio Health?
Great question. So, brio means strength and fire,
Okay.
and coming out of a tough situation. And so, the symbol that I chose, and the name Brio is just because I think that during this time of our lives, it can feel so difficult and so hard, but it's a transformative time, and we can come out of this so improved. And I
Mhm.
think, aging is a very hard process for a lot of women, myself included. And it's like you get up in the morning and you look in the mirror and it's like, what happened? And I think that, we need to get away from some of this and truly start looking at how we're feeling and how we can come out of this feeling stronger and being better for ourselves, for our friends, for our families.
Mhm.
But yeah, it means strength. So
I love that. I One thing that came to mind too is I was listening to another podcast, and it was her saying was, "No pressure, no diamonds."
Yes.
which is such a cool way to say it, like it's going to require effort, it's going to require change in order for there to be growth to happen.
Absolutely. And, that's what I tell all my patients. No matter what treatment plan we put together, it is not going to be easy. It is not going to be something that we just have to sit back and now we can see all these, transformative changes. It's going to be
Mhm.
effort and it's still going to take effort. But the goal is to be able to make the effort possible, to make it to where, your symptoms and your side effects are not preventing you from becoming who you could be. And
Mhm.
that's kind of what it's all about.
When talking to patients, would you say that there's like a handful of things where you're like, you'll probably see results really quickly with these things, but then once we start adding in layering in these extra things, like it
Mhm.
will take time, especially like if you've been unhealthy for 20 years, obviously, and like same thing with women who are pregnant. They're like, it took you 9 months to have this baby. Like it's probably going to take 9 months or even longer to be feeling better.
Absolutely. I feel like with hormone therapy, the quickest thing that we can help with are hot flashes and night sweats. The
Mhm.
vasomotor symptoms, VMS, that's typically what we can treat the quickest. And once we start a treatment, women start to see a difference within 2 to 4 weeks.
Mhm.
It's some of the other symptoms that are there that take a little bit more time. And just like with weight loss, when we figure out and we can do, your resting metabolic rate and we can see your caloric needs and we can adjust because weight loss will always come down to calorie restriction. You need to have a lower amount of calories. In the end, that's what it is. And
Mhm.
so when we can look at your basic calorie needs and we can make adjustments, yeah, maybe that 2 to 5 pounds are going to fall off like that in the beginning, and then it's going to get harder and it's going to take time. And it's not just the numbers on the scale again. It's how are you feeling? Are you getting stronger? Let's look at your muscle mass distribution. Is that improving? And then, hey, let's check out what your cholesterol levels are doing 6 months from now. And oh my goodness, those are, lowering and your blood pressure looks great. Now you can come off these medicines. And so, yeah, it's
Mhm.
it's a whole thing. It doesn't occur overnight, but we will get you there.
Mhm. And right, you're like, "I don't want you just to be skinny and unhappy," that's not a way of life, like, I want you to be, feeling like you're strong and you have energy and all of those other, like, great things that come along with all of those important lifestyle, like, changes.
Exactly, exactly.
So, what does an initial consultation I know you do home visits and you do virtual appointments, but what do those look like, and what can someone expect when they sit down with you for the first time?
So initially, I will send patients a questionnaire to begin with, and so even before we meet, and it's a lot of questions, but it really helps me to understand, medical history, current symptoms, the goals going forward, and so we
Mhm.
can kind of start from a good starting point. The visits typically for the initial consultation is about an hour, um,
Mhm.
and we truly dive into, what's been going on, what's your biggest worry, what do you need to improve? Because while I can get that questionnaire back and I can read it, when I see a patient's symptom, I might be like, oh, let's fix that. And then within talking to a patient, they're like, I'm not bothered by that. And so,
Mhm.
truly getting to know a patient and what they want and their goals of treatment. But typically the initial appointment takes about an hour. We'll come up with a treatment plan at that point. And then usually once we start somebody on treatment, I like to see them back initially within about 4 to 6 weeks to make sure we're on the right path, everything looks good. And then from there, it's just very individualized.
Okay.
For somebody that wants to do the metabolic testing, then
Mhm.
we will meet and we will do the body composition and the resting metabolic rate and come up with a plan from there. And, in a perfect world, we would do testing every month so we could see changes over time. But just because it's not realistic in a lot of women's lifestyles to be able to do that, I
Mhm.
like to do it at least every 3 months, and then we can
Mhm.
really see changes over time and tweak and make adjustments as we go, so we make sure that the treatment plan is evolving as
Mhm.
patients get better.
And do you bring everything to their house to be able to do those,
Um,
like, tests, or
so
do they come to you?
Right now, they either come to me or I've been doing some pop-up events at places. And so I'll have an event and then we'll just kind of fill up the time and I'll bring my machines to that place and
Mhm.
we can do it there.
Okay. That was my next question is what kind of group sessions and community events are you involved with?
Yeah, so hopefully this summer there'll be more and more.
Mhm.
Like I had mentioned, I have partnered with Fit Chick Express in Longmont. And
Mhm.
so we will do groups there. Angie is the owner. She's phenomenal. And she also helps a lot of women with nutrition and fitness plans. And so it's been a really wonderful partnership so far. Um,
Mhm.
but we'll do a lot of group stuff there. I'll bring my equipment and, everybody can it's a good place just to form relationships with other women who are going through this, who are like-minded and who are motivated. And then,
Mhm.
like I said, throughout the summer, I'll be having some more of these pop-up events around Erie and the local communities, and I'll be bringing these machines, and so we can kind of do a bunch of women at once if we want to.
How are you marketing these events?
Usually, I promote it on my social media and on my
Mhm.
webpage.
Okay. Awesome. If you could leave women listening with one piece of encouragement or advice as they navigate midlife, what would it be?
You don't need to be miserable. I think that, I'm so proud to be a provider in the setting that we're in now, where
Mhm.
women have information that we need. I feel that no matter what is going on, no matter what your past medical history is, we can make our own decisions. Women can make the decisions, and finding a provider that will listen to you and that trusts your judgment and that your body best is so important. And so my
Mhm.
biggest advice is advocate for yourself. Never feel like you've been shut down. Never feel like somebody's not listening to you or throwing meds at you. Truly get the care that you deserve and advocate and know that you don't have to be miserable in any of this.
Shelly, thank you so much for being here. This was such a great conversation, and I know so many women are going to feel seen and supported after hearing it. If you are listening and want to learn more or get in touch with Shelly, check out the links in the show notes. And thanks for hanging out with us today. We'll catch you next time on the Erie Wellness Podcast.
Thanks.
That's a wrap for today's episode. Thank you so much for listening to the Erie Wellness Podcast. I truly appreciate you being a part of this journey. If you loved today's conversation, don't forget to subscribe, leave a review, and share it with a friend. For more daily wellness inspiration and behind the scenes content, be sure to follow me on Instagram at the Erie Wellness Podcast. I can't wait to connect with you again soon.